Medical doctor Dr. Chris Reynolds responds to questions about the therapeutic benefits of wheatgrass. Topical steroid addiction is very common. Can wheatgrass help overcome that dependency?
Well, for a start, it's not easy. A very high, extremely high number of people globally who are suffering from what we could probably call steroid addiction. Not because they can't live without it, but their skin erupts so badly when they stop it that they have to use more. This may be good for the pharmaceutical companies, but it's not really good for the patient. There's a condition called red skin syndrome, which is related to tacrolimus, or a drug called Protopic, which is a very powerful and potent immune suppressant. In fact, they use it to suppress kidney graft, organ graft patients, to suppress their immune system to prevent them rejecting the transplant. But these drugs, tacrolimus in particular, when it can cause a red rash, and in particular when they start trying to stop it. And the immunological effect, the immune suppressant effect of these drugs, I mean, it has been reported, people developing leukemias and all sorts of things, but that's another issue. But in terms of controlling their rebound, and the rebound is what happens when people start to come off steroids, and it's extremely common. And I can speak as a GP, and I used to do what every other doctor did. You know, you'd start a patient on a low strength steroid, like a young child or an infant, 1% hydrocortisone, which is pretty low, it's pretty safe, and it would control the redness and the swelling, and for a while, and then it would flare up again, and you put it back on again. But after a while, the patient gets resistant to that particular steroid, so you start something a bit stronger. But you keep the hydrocortisone on the face. You don't want to put strong stuff on the face, but you can put it on the body. Well, frankly, I don't know the difference, but I think it's just as bad wherever you put it. What goes on, then you go from stronger to stronger stuff, and then it becomes more and more difficult for the patient to stop it without getting a really nasty rebound. Some people go cold turkey, and some people are advised to go cold turkey. There's a website that's a very popular website about the red skin syndrome, where the doctor is advising them to go cold turkey. I don't agree with that because it's extremely difficult for the patient, and they suffer really badly, and their skin weeps, and with some of these drugs, with the steroids, the redness just spreads over their whole body when they stop the medication. What the steroid is doing is suppressing the skin's ability to respond to external and internal attack, say from the sun, or from chemicals, or from just the atmosphere or whatever, dryness. So going cold turkey is just not on in my book. But before wheatgrass, I used to just keep applying it on, tell them to keep using it. But the trouble is that after you start using it, after some time, the skin starts to atrophy. It thins out. And what happens is the skin loses its ability to protect the body from external marauders, sort of, and also it reduces the skin's ability to recover naturally from that immune suppression, because of the rebound. It just comes back. So what I discovered after some time, after I've been using wheatgrass for some time, that I could actually, if I started taking somebody off steroids, if they started putting on the wheatgrass in conjunction with the steroids for the first week or two, and then gradually reducing the steroid, maybe just one application a week for the first week, 2 for the next week, but very, very gradually, but putting on the wheatgrass. And it tends to modulate and reduce that rebound reaction. and at the same time you're reducing the steroids, and over a period of time it might take 6 months. It works if the patient is patient or if the doctor's patient. Sometimes you have to go back to the strong steroid for a while. But you have to look, the concept is to reduce the frequency with which you apply that steroid. So it might be 3 or 4 times a day to start with, so 28, 30 times a week, 120 times a month. That's a lot of stuff going on in your skin, especially when it's a steroid. But over 3 months, you might only get down to 60 times a month, but it's half that. You might get down to 10. But you gradually do it, and then usually within 6 months you can actually take most people off the steroids altogether. But it's hard work. As a doctor, it's hard work because you've got to keep the patient's morale up, because they start to rebound and they start weeping again, the skin comes back, and you've got to put them on steroids again. With the severe ones, I often put them on oral steroids to get control. We'd stop the topicals altogether and then gradually bring that down, because you can systemically, you're taking it systemically, you can control your dosage. When you're putting the creams and ointments and things on your skin, steroids, you can't control that, the amount of dose that's going through the skin into the body. And we know that the steroids suppress the body's immune system, and so this is what happens when you stop the steroids suddenly, the immune system reacts, and because there's no modulation, and that's where the wheatgrass comes in. It appears to modulate that reaction. You've got to be very patient, but if you stick with it, it works. So you might only need to use the grass once a day. I think we have something here that's very important in the treatment of eczema, and not because it works for eczema as well in many cases. And a lot of these patients have to stay with the wheatgrass, but at least they're not using steroids.